Well, since the emergence of COVID-19, there has been claims and counterclaims on the potential cure for the virus. Well, even as the World Health Organization insists a cure is yet to be found. United States President Donald Trump had touted hydroxychloroquine as a potential cure for the respiratory illness, even as his Brazilian counterpart, Jair Bolsonaro, also shared a video taking a drug after being tested positive for the virus. Well, still, scientists say indiscriminate use of the drug will cause damage to some vital organs of the body and possibly lead to death. Well, but the debate, rather, is still on the use of hydroxychloroquine to cure COVID-19 still rages on. We'll discuss that later in the course of the program, but first, let's look at the rate of coronavirus infections around the globe today. New coronavirus infections continue to emerge as the global statistics currently stands at 16.5 million, more than 655,000 deaths have been reported and 9.6 million have recovered. Cases continue to surge, particularly in the United States, recording nearly 4.2 million infections. Brazil follows closely, reporting nearly 2.4 million confirmed cases. India still remains third on the list of countries with a high rate of infections, recording 1.4 million cases. Russia with about 822,000 confirmed cases, and South Africa with about 452,000 infections of coronavirus. Well, back home, cases in Nigeria has reached more than 41,000, with about 860 deaths reported. And so far, about 18,000 have recovered. This is COVID-19 Myths and Facts. I am Esther Mopariola. Welcome on board. Social media app Twitter has banned United States President's eldest son from tweeting for 12 hours. Well, the punishment followed a post by Donald Trump containing a video discussing the benefits of hydroxychloroquine. Some, including President Trump, have suggested that the drug works as a preventative measure against coronavirus, despite medical studies that indicate the contrary. Twitter said the post had violated its COVID-19 misinformation rules, and this is the latest move by Twitter to crack down on coronavirus misinformation and the latest escalation in the clash with President Trump and his allies. Meanwhile, social media was abuzz earlier today when a Nigerian primary care physician in Houston, Texas, Dr. Stella Emmanuel, claiming there is a cure for COVID-19. Well, she claims to have treated about 350 patients with hydroxychloroquine, zinc, and Zithromax, and no one has died after treated with such medication.
I'm Dr. Stella Emmanuel. I'm a primary care physician in Houston, Texas. You know, I actually went to medical school in West Africa, Nigeria, where I took care of malaria patients, treated them with hydroxychloroquine and stuff like that. So I'm actually used to these medications. I'm here because I have personally treated over 350 patients with COVID. Patients that have diabetes, patients that have high blood pressure, patients that have asthma, old people. I think my oldest patient is 92, 87-year-olds. And the result has been the same. I put them on hydroxychloroquine, I put them on zinc, I put them on Zithromax, and they are all well. For the past few months, I've taken care of over 350 patients. We've not lost one. Not a diabetic, not a somebody with high blood pressure, not somebody with asthma, not an old person. We've not lost one patient. And on top of that, I've put myself, my staff, and many doctors that I know on hydroxychloroquine for prevention, because by the very mechanism of action, it works early and as a prophylaxis. We see patients, 10 to 15 COVID patients every day. We give them breathing treatments. We only wear surgical masks. None of us has gotten sick. It works. So right now, I came here to Washington, D.C. to say, America, nobody needs to die. So if some fake science, some person sponsored by all these fake pharma companies comes and say, oh, we've done studies and they found out that it doesn't work, I can tell you categorically it's fake science. I want to know who is sponsoring that study. I want to know who is behind it. Because there is no way I can treat 350 patients and counting, and nobody is dead, and they all did better. And then you're going to tell me that you treated 20 people, 40 people, and it didn't work. I'm a true testimony. This virus has a cure. It is called hydroxychloroquine, zinc, and Zithromax. We have neurosurgeons like Sanjay Gupta saying, oh, yeah, it doesn't work and it causes heart disease. Let me ask you, Dr. Sanjay Gupta, hear me. Have you ever seen a COVID patient? Have you ever treated anybody with hydroxychloroquine and they died from heart disease? When you do, come and talk to me. Because I sit down in my clinic every day and I see these patients walk in every day, scared to death. I see people driving 2-3 hours to my clinic because some ER doctor is scared of the dissects board, or they are scared of something and they will not prescribe medication to these people. I tell all of you doctors that are sitting down and watching Americans die.
Well, following that revelation, there has been reactions from social media users. A Twitter user, Kevin Roos, is surprised at the traction the post is getting on the social media app, saying the number 2 most engaged post on Facebook today is the Breitbart video of a group of doctors claiming that hydroxychloroquine is a cure for COVID and you don't need a mask. 14 million views in 6 hours. And Sue Roy says she has more experience with hydroxychloroquine than any American doctor, and it's her specialty in Nigeria, treating malaria, research before disqualifying it. Well, another here says Dr. Stella Emmanuel claims hydroxychloroquine can be used for cure or prevention of COVID-19, and again, the drug is fought so fiercely. Isn't this the drug we take when traveling to malaria-prone areas like Kisumu and don't get any side effects? Well, now joining me to make sense of this is Professor Rosemary Audu from the Nigerian Institute of Medical Research. Good to have you with us on the program this evening, ma'am. So yes,
Thank you.
Yeah, so what do you make of this continued debate on hydroxychloroquine being a potential cure for COVID-19?
Well, it's very simple. Everybody's entitled to his own opinion. However, science has one universal language. It has to be reproducible. And if you have such a finding, it's not just coming on air and blasting people. It's you go publish it, write it up, submit it as a manuscript, and your peers will review it. It will be peer reviewed. And then they can now tell the world that, yes, what you have found is true. So if she's found out that the hydroxychloroquine is good enough, let her write it up. She has enough data, let her write it up, and then we'll get to know. That is how research is done. There's nothing hidden about it. But one thing again is like, from a background check on this lady, we have found that she's a pediatrician, and now she's talking about treating adult patients. So we don't know where is her specialty. So I think science is very simple. It's the same anywhere, any part of the world, and it will give you the same result if what you have done is really true.
Right.
So
with that point now, how far do you think this will go in misleading claims, or rather, how far do you think this misleading claims now can jeopardize efforts in finding a potential cure for the virus?
Well, I think the trials are saying, well, that for me is what she said is not acceptable in science. Let her go and get it proven. Once it's proven, why not? But I know studies are going on, and until we get results that are reliable, that have been peer reviewed, because there are many confounders. This disease, we know there are many people who even recover without any treatment whatsoever. So for her to come and say that she's giving people these drugs and they are doing well, I mean, it's nothing. There are people who are not even taking anything and they are fine. So that's not how science is done. Simple.
So how do you respond to insinuations that COVID-19 has similarities with malaria, making it possible for the use of hydroxychloroquine?
Currently there is no standard of care for the management of COVID-19. So different clinicians are using different drugs that they think, some are being repurposed, that they think will be effective. And these people are, I mean, the patients are coming out well, but there needs to be a study that all confounders will be addressed, such that it will go through the rigor of science before you can say, yes, this drug, it is.
So if that is the case, with all these insinuations, counterclaims, and on what are the likely potential cure for the virus, where do you see all these leading to? Especially where we're left with no other option but to observe the safety guidelines to stop further spread of the virus.
Well, I think we should still maintain the safety guidelines. We should still observe them. And she even mentioned that they don't use surgical masks. Too bad. Just really bad. I don't think she should just come on air and speak like that. I don't think so. Something that globally it's being recommended that we protect ourselves from these droplets. Is the droplets that carry this virus. So you protect yourself by using the face mask, social distancing, and then the respiratory and the hand hygiene is what is recommended. So we should still observe this while studies go out. That, she has said, is just her own. She has said, it's, for me, as a researcher, it's trash until we have findings from research that have been peer-reviewed and reported. That is when we can now say, yes, of a truth, we have found treatment for COVID-19.
All right, and that's a fine place to leave it. Professor Rosemary Audu, we appreciate your insights on the show tonight. And that's it for today's episode of COVID-19 Myths and Facts. Wherever you do, stay informed and stay safe. Until the next one again, I am Esther Omopariola. Bye for now.